Hello everyone. In this video we are going to learn about cruciate ligaments. They are thick, strong fibrous bands. They are intracapsular and extrasynovial. They act as direct bonds of union between tibia and femur. Direct bonds of union between tibia and femur. They are arranged like a letter X. If you see here, they are arranged like a letter X. Hence the name cruciate. You are able to see two cruciate ligaments. One is anterior cruciate ligament and the other is posterior cruciate ligament. They are named as anterior and posterior according to their attachment to the tibia. Anterior cruciate ligament is attached to anterior part of tibia. Posterior cruciate ligament is attached to the posterior part of tibia. Now let's see about anterior and posterior cruciate ligaments. First let's see anterior cruciate ligament. Anterior cruciate ligament is attached to the anterior part of tibia. It begins from anterior part of intercondylar area of tibia. You can see it is beginning from anterior part of intercondylar area of tibia. If you see the direction of anterior cruciate ligament, it is going upwards. You can see it is going upwards and it is going backwards. This is the anterior side. You can see the patella here. Hence it is anterior side. And this is posterior side. It is going posteriorly. Hence it is going backwards. It is going backwards. It is going upwards. And if you see here, the anterior cruciate ligament is going laterally. This is lateral side. This is medial side. So the anterior cruciate ligament runs upwards, backwards and laterally. And it gets attached to medial surface of lateral condyle of femur. This is medial surface of lateral condyle. This is lateral surface of lateral condyle. The anterior cruciate ligament is getting attached to medial surface of lateral condyle of femur. Posterior cruciate ligament. Posterior cruciate ligament is attached to posterior part of tibia. It begins from posterior part of intercondylar area of tibia. It begins from posterior part of intercondylar area of tibia. If you see the direction of posterior cruciate ligament, it is going upwards. Both are going upwards. Posterior cruciate ligament is going upwards and it is going forwards. You can see it is going anteriorly. This is patella. It is going anteriorly. Posterior cruciate ligament runs upwards and forwards. And it runs medially. You can see the posterior cruciate ligament. It is running medially. This is medial side. Medial condyle of femur. It is going medially from lateral side. Posterior cruciate ligament runs medially and it gets attached to lateral surface of medial condyle of femur. This is medial surface, lateral surface. It is getting attached to lateral surface of medial condyle of femur. Next we'll see the functions of cruciate ligaments. Anterior cruciate ligament, it is taut during knee extension. Posterior cruciate ligament is taut during knee flexion. Anterior cruciate ligament is attached to anterior part of tibia. It prevents anterior dislocation of tibia. It is attached to posterior part of femur. It prevents posterior dislocation of femur. Remember the attachment. And posterior cruciate ligament is attached to posterior part of tibia. It prevents posterior dislocation of tibia. It is attached to anterior part of femur. It prevents anterior dislocation of femur. ACL also prevents excess medial rotation of tibia. PCL prevents hyperflexion of knee joint. Injuries to cruciate ligaments. Anterior cruciate ligament is more commonly injured than posterior cruciate ligament. Anterior cruciate ligament is injured in anterior dislocation of tibia. Posterior cruciate ligament is injured in posterior dislocation of tibia. Tear of cruciate ligaments leads to abnormal anteroposterior mobility. We have already discussed that cruciate ligaments maintain anteroposterior stability. Hence, injury to the cruciate ligaments causes abnormal anteroposterior mobility. If anterior cruciate ligament is ruptured, tibia is pulled excessively forwards. If posterior cruciate ligament is ruptured, tibia is pulled excessively backwards. Let us now revise cruciate ligaments. Cruciate ligaments are arranged like a letter X. They maintain anteroposterior stability. Anterior cruciate ligament, it begins from anterior part of tibia. It runs upwards, backwards and laterally. It gets attached to medial surface of lateral condyle of femur. Posterior cruciate ligament, it is attached to posterior part of tibia. It runs upwards, forwards and medially. It gets attached to lateral surface of medial condyle of femur. Anterior cruciate ligament is taut during knee extension. Posterior cruciate ligament is taut during knee flexion. Injury to cruciate ligaments results in abnormal anteroposterior mobility. If ACL is ruptured, it leads to Excessive pull of tibia forwards. If PCL is ruptured, it leads to excessive pull of tibia backwards.